Hey there, welcome. I'm Dr. Michelle Arnold from my Holistic Health channel, Living Well with Dr. Michelle. And I would like to present today the chakras and inner rage, the root of stress-related disorders and chronic pain. And don't worry, if you don't know what the heck chakras are, I am going to explain it for you. Why should you listen to me? I'm Dr. Michelle Arnold Purtle. I am an acupuncturist, licensed California acupuncturist, and I've been in clinical practice for over 20 years in Poway, in Rancho Bernardo area of San Diego. And I see a lot of people with stress-related disorders, anxiety, depression, insomnia. Pain is usually one of the main reasons they come in to see me for acupuncture. And many people are not aware of how well acupuncture can help with many other things, including these stress-related disorders. And you are here because you are probably experiencing something related to stress, and you would like to get to the root cause to feel better. You may be experiencing symptoms of generalized anxiety, some mild depression, restless sleep, insomnia, post-traumatic stress disorder, or your hormones are going haywire. There is an imbalance between adrenaline, serotonin, cortisol levels are either too high or too low. You have many fears. Perhaps you've experienced some traumatic events and you just keep reliving them, and you can have some negative mood swings, or you're always angry, irritable, frustrated, you're impatient, and maybe you have a nervous stomach, and some of your problems with your irritable bowel are related to stress. And you want to improve your emotional intelligence, or you are looking for personal growth, some empowerment, feeling more self-fulfilled, you're interested in good health and overall well-being, or you want to find your purpose and passion in life for career and life success. And the chakras, if you've heard of them, you might know they are part of what we call mind, body, spirit medicine. And this is a form of holistic medicine that addresses the whole body. So your physical level, this is your structural being, your bones, right? Your muscles, tendons, ligaments. There's your mental level, that's your brain and your thinking, your cognitive ability. Your emotional, spiritual level, and yes, that's your emotions. And many illnesses and imbalances begin in the emotional, spiritual level before disease affects you at your mind or physical body. And many healers will shorten the name of mind, body, spirit medicine to just mind, body. So we know that that also includes the emotions and your spirit. The emotional, spiritual level, what we mean is this has to do with your thoughts, your emotions, your feelings, your deep belief systems that you carry about yourself, your inner soul, your inner spirit, and that Shen. In acupuncture medicine, we talk about the Shen that you can see in a person when you look into their eyes. It's the sparkle in their eyes and the complexion on their face and just their general being and their presence. And the belief system that you carry can be about yourself, your family, your society, your country, and your world. Thoughts and emotions, these are what you are often telling yourself. You might have an angel on one side of your shoulder and a devil on the other side. So these can be conscious, you can be aware of them, and especially when you're feeling the emotions, they can be subconscious, you're unaware of these deep belief systems and the negative beliefs and thoughts that you're always telling yourself. So there's a lack of awareness, you have negative beliefs, and you are repressing these emotions, which then become repressed rage. And this repressed rage blocks circulation of chi energy. And when we say chi energy, think of oxygen that must be carried in your bloodstream. And of course, the blood circulation is being blocked. So this is felt in the body as tension. And emotions, there are some very basic universal emotions that all human beings have. We all feel these and express these at one time or another, and they should be expressed at appropriate times, but quite often they become imbalanced, where maybe we're always angry and for no reason, or any little thing will just set you off. That is an imbalance, right? Or if you're carrying grief and sadness just far too long and you can't move on. And the basic emotions are anger, joy, and there are some other forms of joy, or we can have overjoy, like elation, like it's just overzealous, or even apathy, or just a lack of joy, just kind of blah. Disgust, worry, overthinking, like being obsessive, the thoughts are just going round and round. There can be grief and sadness, melancholy, loneliness, disappointment, and regret. These are all just different aspects of sadness. And then there's fear, surprise, shock, trust, and willpower. And the image here is just a little schematic, just to show you how everything affects something else in your body. All of the systems are working together and nothing is separate. And you are your thoughts. So what you believe about yourself is who you are, and what you tell yourself is who you are. And your thoughts send signals to your glands, your endocrine glands. So your glands thus release specific neurotransmitters and hormones related to your thoughts and related to the emotions. So negative neurotransmitters happen like when you are just stuck in that fight or flight mode of your sympathetic nervous system. And this reduces oxygen output to, let's say, a certain tendon in your elbow, or that muscle in your forearm, or in your shoulder, a joint, or a bone. And that shoulder or elbow becomes oxygen deprived, and the result is pain. And over time, this can result in actual physical changes. So, and this is a protective maneuver, and you will learn more about this in a minute. And the image here is just showing that some blood cells, and the blood becomes constricted and even clumps together when it becomes stagnated. And all emotions are felt in the heart. And there is that saying, and there is truth in that. The heart tells the brain how to feel and how to react. It is not the other way around. Surprise. And there is an article, The Heart, Mind, and Spirit, where the author introduces the heart brain, or little brain, he calls it. So the heart, research shows, has efferent neurons that go from the heart to the brain, not the other way around. And the heart now is known to have its own intrinsic nervous system that operates and processes information independently of the brain or the nervous system. And it will, learn and remember and even feel and sense. So these studies, provide the scientific basis to explain how and why the heart affects your mental clarity, creativity, and emotional balance. The heart chakra is proof. The heart chakra is located in the center of your breastbone, and it houses the organs of your chest cavity, the lungs and bronchi, and yes, the heart. And the Heart Math Institute is a nonprofit organization, and they study the heart and mind-body techniques. And they say evidence shows the heart plays a greater role in our mental, emotional, and physical processes than previously thought. And they find the electrical field created by the heart, as is measured by an electrocardiogram, is about 60 times greater in amplitude than the brain waves, which are recorded in an electroencephalogram. So that is from the Heart Math Institute. So when we are talking about an electric field, or maybe an aura, or electricity, the body does have an aura, it has an electric field, and it has electricity. So that there is truth in that. And when we talk about alternative medicines that have known this for eons, we can see now science is catching up. Repressed rage. It is the root problem in our mind body, causing a blockage of this chi and energy flow. And this blockage, we can call it congestion. So there is only one disease, congestion. There is only one cure, and it is circulation. And this is the basis of traditional Chinese medicine, TCM. So there are therapies that address all three of these levels: your body, your physical level, your mind, and your emotional, spiritual level. Some examples might be classical 5-element acupuncture, sound healing, like using tuning forks, Tibetan bowls, chanting using the sound of your own voice. I like aroma tune. That's my own thing, using essential oils and a tuning fork. And of course, there's meditation, breathing exercises like Qigong. I already mentioned aromatherapy and essential oils. There's Reiki, craniosacral therapy, much, much more. So how do these therapies work? Well, in a nutshell, increasing that flow of chi energy and blood in these chakra and meridian systems. So think of chakras, think of meridians, actually not as something that you're going to find anatomically, but it's really some things that are already, some structures that are together in your body that are kind of wound together along a pathway. So like a nerve, a blood vessel, your lymphatic systems, connective tissue, fascia, and muscles. So if you look at this image, you can see these bundles here. There's the green, there's the lymph, there is the arteries in red, and the veins in yellow, and the veins in blue, sorry, and the nerves in yellow. And along the pathway here, they run pretty close to what the ancient Chinese have called meridians, or channels related to each organ system. And it's pretty similar along that way. So if we think of them that way, I think you can get a better grasp of why they work and why they're so effective in reducing pain, improving your range of motion and mobility and activity level, energy, sleep, mood, immune system, metabolism and digestion, libido, reproductive health, slowing, aging process, and also improving your skin and complexion. So overall, giving you a better, more positive, radiant outlook on life. So natural self-care can help to clear these pathways. So if you're using natural, healthy routines, you can have a healthier lifestyle. And I like to help people learn about acupressure, tuning fork healing, essential oils, chanting mantras, and using positive affirmations. So if these things can help change your perspective, help you, respond more appropriately to stressors, change your thoughts and beliefs about yourself to more positive ones, this will release inner rage and those pent-up emotions. The tension is released, now allowing more flow of your chi energy and blood. And just take a look at this image here of an artery, the inside of an artery, and you see vasoconstriction versus vasodilation. Here's normal, and then here's where it's constricted and the walls are just narrowing, and then vasodilation where it's even wider and you have a much greater volume of blood. And I teach these natural self-care, mind-body techniques in my Living Well with Dr. Michelle, my holistic health channel on Locals. So you can go there and check it out. livingwellwithdrmichelle.locals.com. The /support will give you different ways, different choices on signing up. But why? Why work on your spiritual level? Because the best results are achieved from any outside therapies. Like if you're doing acupuncture, chiropractic, you're exercising, eating right. Everything works better when a person is working on themselves. Like it's your homework. Do the inner work on your own physical, mental, spiritual levels. Nobody can do that for you. So before beginning any work, have an idea about the chakra meridian systems and the connection with inner rage, becoming aware that it is the first step to releasing this inner rage. And as I will mention a little bit later, inner rage, pent-up emotions, these are universal things that affect everybody. All humans do this. It is a protective maneuver, as I'll explain later. But first, the chakras. What are these? Well, there are 7 chakras. There's the root, and this has to do with our feelings of trust and safety, and it's here in red at your perineum and coccyx. The sacral chakra has to do with our feelings of sexuality and creativity, and it's located just below the belly button. And the solar plexus is located in your upper abdominal area. It has to do with feelings of power, strength, and your inner wisdom. The heart chakra in your chest area, love, healing, forgiveness. The throat chakra, your suprasternal notch at the base of your throat, has to do with communication, so that's speaking and listening. The third eye, between your eyebrows, on your forehead, awareness, intuition, and your cognitive intellect. The crown chakra, your spirituality on the crown, the top of your head, your connection with the divine and having faith and any, powers that are bigger than yourself. So, what are chakras? Still probably didn't tell you what they were. Think of the chakras as neurovascular bundles that are located physically along the midline of your body, on the front midline, and along your spinal column at specific spinous process levels. Okay, so they are swirling vortexes of this bioelectric energy. And there is this electric field that swirls like a cone shape out from the body, and it goes into the body and reaches on the backside as well. So it's energy that's actually spinning out and in, taking in and taking out, like releasing and receiving. And these have a neural and vascular connection to glands and to organs. So maybe you've seen those other images, like if you've been at your chiropractic office and it just is crazy with all those nerves connecting everywhere. This is sort of like that. And some healers like to call these psycho-neuro-endocrine centers, P&E, but I like chakras. So the endocrine system is directly related, as I mentioned earlier, to hormones and thoughts. So that is why endocrine system and the chakras and your thoughts are really all one and the same. You can call them power stations of your central nervous system. So again, there's a nerve bundle called a plexus and an endocrine gland, and also connective tissue called fascia that's kind of intertwined in these areas. And there are many more chakras, much more than I'm going to talk about here, but this next thing, talking about the 21 minor chakras, this is probably more for acupuncturists, if there are any acupuncturists out there listening to this, because these minor chakras are mainly used for pain relief. They're bilateral and they correspond to an acupuncture point. There are minor chakras located on your feet, the hands, the elbows, the knees, your groin or gonads, your clavicles, intercostals, your rib cage, your ears and jaw, shoulders, the navel, and one extra spleen chakra found only on the left side below your rib cage. And there are 14 main meridians. 12 of them are bilateral: lung and large intestine, spleen and stomach, heart and small intestine, urinary bladder and kidney, the pericardium and triple warmer. Now, these are fascia internal membranes, and they're highly electric, and they are not considered organs in Western medicine, but they are in acupuncture medicine. The gallbladder and liver, and then there are 2 that divide you in half, one along the anterior and one on the posterior midline, called the dew, the governor, that is along the spine, and the ren is down the front line. A little history in medicine, Ayurvedic medicine, similar to acupuncture. They're both, who knows which one came first truly, but over 2000, maybe even 2500 years ago, Hindu texts called Vedas describe the chakras. And This information was brought to the Western world in 1919 by an Englishman named Arthur Avalon, and his book called The Serpent Power. So there is some overlap and similarity to traditional Chinese medicine. We both believe in this energy that flows in channels or nadis, prana or chi. And there are 7 major chakras along the midline that correlate to major acupuncture points. So this image might just interest some acupuncturists here. Thoughts, once again, signal those neuropeptides and hormones. And there are specific frequencies that would trip those neuropeptides. So in response to anger, joy, elation, or apathy, disgust or worry, grief, fear, or shock. And then this emotional repression, it leads to repressed rage. And we can help by becoming aware and also having some lifestyle adjustments, changing those negative thought patterns to positive ones. This is addressing the root cause of disharmony, or really we could say stress-related disorders and chronic pain in the body. Where does this inner rage come from? It stems from our beliefs and values. These are survival patterns, okay? And we develop these maladaptive coping mechanisms to deal with it. We avoid and ignore these distressful feelings. We become unaware of our inner conflicts and fears, and they're stored in our subconscious mind. So where are the sources of inner rage? There are 5 sources. Childhood. So childhood neglect, abuse, disapproval, or even abusive, toxic relationships at any age. Self-imposed pressures that we put on ourselves to be perfect and good. And this is so that we can gain approval. We are looking for approval because underneath it all, we have low self-esteem, low self-worth, feeling inferior, and as if we are just not good enough. Really, in a nutshell, everything slices down to that, our feeling of worthlessness. Self-denial and self-sacrifice. Again, the need for approval and to be accepted and to satisfy this feeling of worthiness. And practicing self-denial and self-sacrifice, it leads to feelings of loss, sadness, disappointment, regret, resentment, loneliness, and anger. Like putting yourself last, always giving to everybody else, paying your money to help somebody else go to college, like maybe a younger brother, when you really had the desire to, when you save the money, but you're going to give it to the other person to help them. And, underneath you may have a little bit of some rage, and that was maybe to have approval of the parent or even of your brother. Just an example. There's pressures of life. So just things that many of us go through, wanting to feel secure and safe, looking out for our well-being, healthy relationships or difficult relationships, child rearing, marriage, traffic or career, school, finances, worrying about success, achieving success, whatever that is for you, health, worrying about aging, and worrying about mortality. And other miscellaneous feelings and stress, guilt, shame, fear, insecurity, vulnerability, injustice, the need to be taken care of, self-absorption, extreme superiority complex, like, a narcissist. I'm not going to talk about that in this talk. There's not enough time for that, but, that does also feed into the reservoir of rage. Why does this happen? Well, too many emotions and conflicts, it would just be too much to bear. I mean, we have a lot to handle on a daily basis, and there's so much information just going in and out of our brains and our thoughts, and it would just not be possible to deal with them all at once. So 2 things would happen if they are not pushed to these subconscious minds. We must push these to the subconscious mind, or the childhood, what we could call an id, would take over and we would become an angry, belligerent individual, like a raving, ranting lunatic. And you might know somebody like this. And this is not acceptable. Otherwise, we risk being ostracized and further lowering our self-esteem. And this person generally who just, isn't able to push things into their subconscious mind or unconscious mind, they don't handle stress at all very well. They don't handle things or little conflicts, or if anything doesn't go their way, they are probably even the person with road rage, just an example. Or number two, we become paralyzed with grief. We're unable to function in the face of any unpleasantness. And this isn't acceptable either, because then we're hiding. We don't take care of our responsibilities. We're not taking care of ourselves. So your brain, with its thoughts and nervous system, it triggers pain and illness to shift the focus away from these distressful emotions, the pain, illness, anxiety, insomnia. These can all be things that are just taking over, letting us focus on that instead of the distressful feelings like that repressed rage. And what is pain anyway? It is triggered by an unpleasant stimulus, like bad pain, negative thoughts, stressors. So the nerve endings in our bodies, in response to an unpleasant stimulus, release inflammatory chemicals, and this induces that chronic state of fight or flight response, that sympathetic state. So in a sustained sympathetic tone happens versus the rest and digest, and that the rest and digest is part of our autonomic nervous system, where we can relax. So these inflammatory chemicals are sticky, and we have sticky pressurized fluid buildup in our tissue, and it causes the muscles to stick together. It creates contraction, weakness, trigger points, tenderness, adhesions, tight bands, maladaptation, and further blocks that flow of our chi energy, blood, and lymph circulation. And those muscles, the tendons, the bones, they're getting deprived of oxygen. So under healthy conditions, these nerve endings should be releasing water, ions, proteins, and it should be fluid like water, which is then absorbed in the muscles and pumped out. Reverse the damage. So if you're going to use chakras, you can use these chakra power stations to stop the neurogenic inflammation. Unstick the tissue by cleaning the area. Now, this would be using manual release techniques, like I like gua sha, and that is a form of what we call rubbing the skin, and or find another non-noxious, non-bad stimulus that will release good neurotransmitters like dopamine, glutamate, GABA, so feel-good hormones. Sound healing is one of my favorites, like using a tuning fork, because the sound and vibration and the pressure will release these pressurized sticky fluid from the tissues. You can chant a mantra with the power of your own voice, because your voice resonates in your rib cage and in your bones. Chanting or reaffirming, positive affirmations, and begin with awareness of your core beliefs that are stored in your root chakra. That's the first step. And what are belief systems? They are stored in the root chakra energy center. And we will begin this again in part 2. So stay tuned.